Hi, my name is Sandeep Bedi, and I'll be presenting mobile devices in healthcare and how it's improved healthcare over time. So, what is a mobile device? Well, a mobile device is usually a small handheld device capable of computing and processing wirelessly. Like for example, your cell phone or tablet would be considered a mobile device. We've defined mobile devices to be helpful in three primary categories. The first of which is patient portals, the second of which is procedural work, and the third is telecommunications. Just to give you some background, patient portals would be interactions with the patient through the provider. Procedural work would be things like surgeries, suturing, and what have you. And thirdly, telecommunications would cover like any kind of interaction, whether it be patient to provider, provider to provider, or really any of those two things. So to elaborate on what a patient portal is, you may actually have one being a patient yourself. As a Kaiser member, every Kaiser member now has a patient portal. You just go online and you can check all your results. You can check your patient history. You can see your vaccinations. It's really easy to access all your results, print them out. Now you don't have to go to the doctor to figure out what you have and haven't received as far as healthcare is related. This really makes a lot more transparent between the patient to physician, and it's been implemented as it started implementation about 6 years ago in 2011. In reality, this has really improved on what we had before, which was a lot of paper. And when you went back to your doctor in the past, you probably saw this huge wall of folders that you can see on the right-hand side of the slide here, with all these names and dates next to them. And what used to be the case was that all your patient results, all of your consultations, all of your paperwork was kept inside of a file with your name on it. And if you needed anything, they would go into that file, copy it, and give you a copy of it, and then they keep the hard copy for themselves. But now that everything can be digitized and put online and stored in the cloud, um, you don't really have to deal with that. And it saves a lot of space inside of the doctor's practice, and it also just makes things a lot easier to find. So it produces a lot more efficiency when you're dealing with patient to provider interactions. Now, in the situation of telecommunications between the patient and the provider or provider to provider, mobile devices have changed a lot. It used to be like the fax machine or secure mailing by paper, but now you have most faxes are actually run through email services that are HIPAA or FI compliant, and telecommunication in general has just changed as a result of mobile devices entering the healthcare sphere. So now I guess you can even discuss how patient portals, you can email your own doctor, you can receive your results through your doctor, doctors can share results through um, faxes, emails, and mobile devices. I've even seen some doctors trading imaging results with surgeons just via email, um, a secure email, and it really does make a lot of a difference in reducing waste and time in sharing health histories of patients. So throughout my discussion of telecommunications in this bit of the PowerPoint, I've already mentioned some of the major benefits and the common different mobile devices that have been given to physicians and care providers in the healthcare field. But I think one other one that I didn't go over is Vocera, which is on the previous slide. But basically, it's a great text, voice to text communication method. It enables the doctor to document faster and basically make clearer documentation in less time, thereby improving communication between physicians um, over the course of a patient's care. So the next thing we have up is procedural technology. So like I said in the past, mobile devices like iPads or iPhones or smartphones are all now starting to enter the healthcare industry. And so I actually found this article about how iPads are being used in different things like knee replacements because of their gyroscopic functionality and being able to make cleaner and more effective prostheses for patients. There seems to be like a lot of versatility from what a lot of surgical um, testaments say inside of the article. I highly recommend reading it. It's actually really interesting. But like in general, the procedural technology sphere has increased greatly with mobile devices. So this slide here just has some pictures of those mobile devices and that could be used. The one on the left I've already really gone over, like an iPad inside of surgery, but on the right hand side you have like an ultrasound which can be connected to a smartphone device. You can see all your work on a smartphone device, and I guess it makes for a lot less of a bulbous machine entering the patient's room, and it also puts your results in the palm of your hand. So in conclusion, obviously we can tell that mobile devices have really helped the healthcare industry. These are just some of the resources that we used while researching our topic. I hope you enjoyed the presentation. And that's pretty much it. Thank you.